to know, Daktari, if you have stats, or Eva, if you have stats about the kind of need when it comes to health and treatment, or even care, because sometimes we forget that the needs of a woman are very, very different from the needs of a man. So kindly just paint a picture for us to get to understand deeper what you're dealing with at Zuri.
Okay, thank you for that question. So as I said, I'm very passionate about women's health. And if you think about a women's health journey, it actually starts when she starts puberty.
Yeah.
Right? When she's 12, 13. That's when her reproductive health journey starts, right?
Right.
So, and from that young girl of 13, 14, sometimes some of the issues that she's dealing with is period pain, for example, right? So what kind of medication is she taking? What exercises can she do? What can she eat? So again, we can do that consultation online, of course, with the mother's consent and the mother being present, right? The other thing that we do, then she moves out from, that is high school, all the way to when you turn 18 years old. When you turn 18 years old, you're in campus, right? And now you're active out there, right? So we actually have a program called Nikona Choice.
Yes.
Yes, and the Nikona Choice program actually is free consultation for any woman who wants to know about contraceptives. So you can actually call our number, or you can WhatsApp us, and I'll give you that number right now. So Vera, a WhatsApp number is 0756 551 551.
Okay.
All right, that's an easy number to remember.
Yeah.
So you can actually talk to our doctors and ask, consult and find out this is what's happening in my body. This is, do I take hormonal contraceptives, or do I take non-hormonal contraceptives, right? So that is what we are able to do. So we advise you accordingly.
Yes.
And if you want to come to be fitted, we can actually do it at our clinic. Or if you're far from us, we can actually advise you which is the nearest clinic to go to. Okay? So that is very important for us.
Yes.
So what we did over and above that, we actually have a series on YouTube. We call it the Njeri series.
Njeri.
So Njeri is our, she's this lady, she's in medical school, right? She's navigating life. Of course, she has friendship, she has a love relationship, and she's asking questions among her friends and her girlfriends, and also, a doctor.
She's single. Muli has been single for a long time.
She's not single. She has a boyfriend.
She has a boyfriend. But
she has a boyfriend. But
Muli has been single for a long time. At least 7 years, bro.
We talk about Zuri. What was Zuri?
Plug.
No thanks. I don't want to snatch Njeri from anybody.
I know.
You can't get Njeri.
I can't.
Someone else, maybe.
Yeah, I can't.
So Njeri series, we actually created because we were like, who are we talking to? We're talking to the young ladies between the age of 18 to about 25 years old. What will they resonate with? And they resonate with Njeri and her struggles and her ambitions, right? And actually you find, so we release every series every Friday at 6 p.m. And we actually see a surge in our portal in terms of people asking questions, both male and female.
Okay.
Right? And the beautiful thing about the Nikona Choice, we also have a therapist. So we also realize that people during that age, because they're struggling with so many things, mental health is a big concern.
Yes.
Right? So it's also good, not only are you talking to an OBGYN, but we're also talking to a mental therapist.
Yeah.
So we combine that, right? And so that is what we do for the young women, especially age of 18 to 25. Then, of course, now you may be at an age where you want to start getting, you want to start having babies.
Yes.
So now we also have consultants and specialists. So we actually have gynecologists and OBs and pediatricians for that, right?
Love it.
And then we come to your age when you're starting to turn 40 and all these things are happening with your body and you're wondering what's going on. We call a chama meeting to discuss it. And I don't know what's going on with me.
Yeah.
We're telling you, call our doctors.
Right.
And of course, we're able to advise you what you need to do. And then we have, what we have also done when we realize that we have special packages for women.
Okay.
So I know once a year we are all advised, isn't it, to go do a proper wellness of yourself, right? So we actually have wellness packages for, of course, everybody, but specifically also for women. So women, there are certain things that women at that age want to do: thyroid tests, vitamin D, right? And I'm sure Barbara will elaborate that further. And those are the things that, because those ones are able to tell you how your hormones are doing and what treatment you need to have or what you need to do. Do you need to change your diet? Hence why we have a nutritionist.
Nice.
Yeah, because there's things that I need to lose weight because I need to be, I'm being told that to lose it, but I don't know how to do it.
True.
Right? But somebody is actually walking the journey with you and keeping you accountable and telling you need to exercise, but also these are the foods that you need to eat. Right? So that is part of the program. So we're taking care of the woman from when she's, as I said, 14 years, 12 years, all the way until she's 65.
I love that.
Yeah.
I'm looking at the Njeri series. Essentially, the numbers are absolutely high. You can tell ladies love the episodes. 29K subscribers so far, 32 videos. The pool of specialists, Barbara, there's a lot. I mean, I love that. Give us a ballpark. How many specialists do we have for women?
For
in
women,
your portal, yes.
Women's health is a very big aspect of Zuri Health. It being women's, we celebrated Women's Day just a few weeks ago, and we're still in the theme of celebrating women, empowering women.
Right.
So with Zuri Health, we really focus a lot on that. For women, you're asking about
the specialists. So she's talked about contraceptives, she's talked about thyroids, all that stuff. What more can we find there? The ladies who are probably, worried about their health. I mean, can I get, cancer screening, all these things?
Yes. For our wellness package, because there is a women comprehensive wellness package at Zuri Health, right? So for that, you can come in and we do vitals start, just basic vital start, and then just to make sure you have to assess your blood pressure, your pulse rate, respiration, everything. And after that we do a full body composition. So for that you will get your water ratio, your BMI, your fat ratio, muscle, fitness, bone density, stuff like that. All that is assessed in your full body composition. And then after that there is the urinalysis that has to be done, just to make sure your urinary system is okay.
Yes.
Imaging is done. Imaging, so we are looking at breast ultrasound. We need to screen for breast cancer, right? Abdominal pelvic ultrasound in case there's any malignancy within any anomaly. Anomaly, wacha tuseme hivyo, unless kuna shida yoyote. Right.
Umepotea hapo. Ilikuwa
my guys in the village wako but thank you for breaking it down.
Yeah, so you have to check the abdominal region, the pelvic region, just to make sure everything is okay.
Yes.
Part of the package also includes an echo, just to check the heart function, because especially women, as you're aging, black women, have to say, we are at a greater risk of getting heart attacks.
Yes.
So it's
Why
important.
Black women though?
It's really a risk thing. Blacks in general have a higher risk of getting MIs, heart attacks, and whatnot. So it's important to regularly screen for that. So part of our wellness package for women includes an echo, cardiogram for the heart, and ECG, and also cervical cancer screening, of course, because it's very prevalent here in Kenya. So it's important to catch that much earlier. Yeah, and then there's also the mental wellness bit. It's 2025. We cannot not talk about mental health. Yeah, it's part of the services that we offer for women. It's